So this patient, we're going to make a surgical guide to replace teeth number 10 through 13. We're going to have 10 as a cantilever off of a 3-unit bridge and out of occlusion. We've already meshed the DICOMs together, and the only interesting thing about this case is the CT scan was taken without implants, or without the teeth in place. If I could show you that. This bridge fell out. It was a bridge from this lateral all the way to this premolar. It fell out, took a CT scan, and when I imported the model scan to align everything properly, I was able to add implants in the correct position without having to wax this section up. So in the surgical guide, when we go to make our surgical guide in this area, I'm going to have to take this model. So go into surfaces, click on model, and I'm going to have to cut these teeth out before I make the guide. So what we'll do is we'll isolate, cut, hold down the shift key, and this tooth's going to be missing too. So I'm going to remove the lateral incisor, the canine, premolar, cut all those out, and we'll double check it. Now it's going to say the mesh cut failed. I'll show you how to append that and fix it. So this is good for the most part. If you want to fix this mesh cut, what you would do is go to File, Export DICOM data, and in Mesh Mixer, go to Analyze and Repair Model. I don't look like I have any holes in this thing. It looks like it's good for the most part. So from here on out, what we're going to do is go ahead and make our guide on this. You can see this is our lateral incisor. This is where our implant's going to be for a 3-unit bridge, cantilever off the lateral incisor. And what I forgot to do, which I'm going to have to undo this cut, is I always go into surfaces and take my model and duplicate it. And I'll turn this one off. So I'm actually going to cut this model, have this as a model cut. And then so again, we'll do this one more time. Go back in here and click on Cut Tool, Shift, extract all these. Looks good. So now I can turn off my DICOM and make a surgical guide on this. And that's going to be pretty simple. And I always like to do cross arch stable, have anterior and posterior guidance. So you could do from the midline down to here if you wanted to. I kind of like to get some teeth back here. So guide, make sure we're on model cut. Click on draw curve, maxilla. Hold down the shift key. And click on edit. Get this off the tissues. All right, create surgical guide. And here's our guide. That's pretty much it. This will be our first guide. And we're done.